Today, we are going to be talking about prediabetes and, most importantly, how to stop prediabetes from developing into diabetes. Almost anyone would say they know or have an idea of what diabetes is, but a lot less is known about prediabetes. So the question is, what is prediabetes? Prediabetes is a condition where blood sugar is high, but not so high as to be diagnosed as diabetes. So to receive a prediabetes diagnosis, the patient has to have a higher blood sugar than is normal, but not as high as that of a diabetic patient. When one has an understanding of prediabetes, it could help with the early detection of diabetes. This could lead to early prevention, which would potentially reduce the number of individuals who go on to get diabetes. Studies show that if left untreated, about 37% of people with prediabetes may develop diabetes after 4 years. An estimated 35% of adults live with prediabetes, and an awareness of prediabetes may help doctors and people in decreasing the number of patients that develop diabetes, and also with prediabetes prevention. Now, let us talk about what causes prediabetes. The pancreas, which is an organ found in the body, makes a hormone called insulin that helps the body convert glucose into energy. Basically, food with carbohydrates enters the body as glucose, which is also known as blood sugar. This blood sugar stays in the bloodstream while the pancreas releases insulin that allows the glucose to enter the body's cells, where it is used as fuel for the body. When the insulin is not as effective as it should be, the glucose gets stuck in the bloodstream, then accumulates, which causes blood sugar to rise. Prediabetes acts as an indicator showing that insulin is beginning to be less effective. It shows that the body is becoming resistant to insulin, which makes the blood sugar rise, developing into prediabetes, which if not controlled or stopped, would develop into type 2 diabetes. Having said all this, one might ask, how do I know I have prediabetes? Prediabetes is said to have no obvious symptoms apart from darkened necks, groin, and armpits. Recently, studies have shown that prediabetes is majorly connected to genetics and lifestyle. So fortunately, one may prevent prediabetes through lifestyle modification. Majorly, prediabetes risk factors are overweight and physical inactivity. Ethnicity, age, family factors, smoking, and so on are also factors that could act as risks too. So the important question is how to stop prediabetes from developing into diabetes. Like we said earlier, prediabetes is reversible, or can be prevented by making a conscious effort of changing lifestyle and maintaining healthy body weight. That can be done through the following steps. Number 1. Eat right. There are no special foods or diets for people with prediabetes, but the kind of food or drink taken could risk developing type 2 diabetes. People with prediabetes should always eat right. It is usually advised by healthcare givers that patients eat more high-fiber foods, vegetables, fish, fruits, and take little food with sugar, sodium, and alcohol. They are also advised to cut back on white bread, sugary snacks and cereals, processed and red meats, carbonated soft drinks, potatoes, and so on. Number 2. Exercise more often. Exercising is one very great method for prediabetes reversal, because when someone exercises, the body uses more glucose, making glucose clear out of the blood. Also, exercising is helpful in decreasing overweight that acts as a risk factor for prediabetes. Exercising does not necessarily mean going to the gym. Doing as little as walking instead of taking the bus, riding a bike to work, swimming, playing sports, dancing, hiking, walking, and so on can reduce or totally stop the risk of having prediabetes. Number 3. Drink a lot of water. Since water does not have calories, sugar, or carbs, drinking water is a very important way for prediabetes prevention. In 2011, a study was carried out that showed that individuals who drank plenty of water every day had a 72% chance of not having high blood sugar. Studies show it is ideal that men should drink at least about 14.8 cups and women about 10.6 cups of water every day. Number 4. Stop smoking. It is a known fact that smokers have high chances of having kidney problems, lung cancer, and even heart disease. But then smoking can also increase the risk of having prediabetes too through insulin resistance. Smokers have higher chances of developing type 2 diabetes than non-smokers. Number 5. Get enough sleep. Sleep is very important for our well-being and health. Depriving the body of sleep can reduce one's productivity and make it hard to shed excess weight. Irregular sleep could make prediabetes develop into diabetes because it makes insulin less effective. At most, 7 hours of rest can go a long way in reversing prediabetes. Also, avoid caffeine, caffeinated drinks, and alcohol before bedtime. Number 6. Avoid stress. People react to stress differently. Some people tend to eat foods that are unhealthy, smoke, and do activities that are bad for prediabetes reversal. When one is stressed, the body produces a hormone called cortisol that increases blood pressure. Cortisol acts upon another hormone known as glucagon that activates the release of glucose from the liver into the blood. When the level of cortisol is high, it makes insulin become resistant. The pancreas will over time find it hard to keep up with the need for insulin, and so the glucose level in the blood will continue to be high. Relax more often. Meditate. Which of these surprised you the most? Let us know in the comments below. Here are 2 more videos you might find interesting. Feel free to choose the one you like. If you enjoyed this video, give it a like and share the video with your friends. And for more interesting videos on health, subscribe to the channel.